I'm Liz. I'm going to show you today how to properly change a PICC line dressing. The reason I'm doing it is because, oh, by the way, I have pulmonary hypertension, and recently I had a line infection when it was on my chest, so they had to take that out. And before they did that, they placed a PICC line so that I can continue receiving my medication through this tube that's connected to a pump, which is called Remodulin. I have a double lumen PICC line because when you have an infection in your blood, like I did, protocol is to be on antibiotics for a few weeks. So this one is for the antibiotic that I'm doing every 8 hours for almost 3 weeks now. And the other one is for the continuous Remodulin infusion that I'm getting 24/7. Now, a nurse is supposed to come to my house from home health every week to change this dressing. It's supposed to be done in as clean as an environment as possible. And the reality is not all RNs are completely up to date on aseptic technique and sterility. So yesterday I had a nurse come to my house and change the dressing, and it wasn't done properly. The only reason I know, which is the irony in all this, is that I worked as a surgical technologist or scrub nurse in the operating room for 18 years. So I know sterility, I know aseptic technique. This is my 4th line infection, and I don't want to go through this again. And this is the reason that I'm making this video. You are not supposed to change your own dressing. That is not recommended. Because most people don't know aseptic technique and sterility. But I'm going to do it with my left hand just so that you know what the standards are and how it's supposed to be done and how it's not supposed to be done. There's different types of dressings. My skin has become very sensitive, and so I don't like to use the ones that have like blue strips underneath. They're kind of like stabilizers for the PICC line. You can't see it through here very well, but it looks like a little butterfly. What has been happening with me is my skin is so sensitive. When this tube is just sitting on my skin for such a long period of time, my skin starts itching and getting irritated. So what we've been doing in the past is putting a little gauze or telfa dressing underneath this plastic so that it's not constantly on my skin. That's not recommended because it can harbor bacteria, but that's what I have to do. Otherwise, I'll start getting rashes, and that's not good either. This little patch here, it's called a BIOPATCH, and it has some antiseptic qualities in it. In the past, I was even not allergic to it, but very sensitive to it because it's so strong. But so far, so good. I've been using a BIOPATCH for the past 3 weeks, and my skin is okay. So that's really good to keep that right at the exit site. So when you do a PICC line dressing, the first thing you want to do is wash your hands. Wash your hands really well, and you don't want to dry them with a towel like that you keep in your bathroom hung, because those harbor bacteria. So the best thing to do is wash your hands really well. Wash underneath your fingertips because they can harbor bacteria in here. My infectious disease doctor also recommended that I remove my gel nails. Because he said it can harbor bacteria. So fake nails, acrylic nails, all of that. You have to keep your hands very, very clean. So anyways, right before I started this video, I washed my hands with scrub soap or scrub solution, and I dried them with a paper towel, not with a regular cloth towel that harbors bacteria. So my hands are nice and clean. Now this room, it's not an OR, so it's not going to be a completely sterile environment. We just try to keep it as clean as possible. If there's anybody helping you, usually it should be a nurse doing it, both of you should be wearing a mask. So if a nurse comes in and they don't give you a mask to put on, wrong. You must tell them, I need to wear a mask too. So, and you want to do it in a clean environment. You don't want to be doing this in the bathroom, or even in, maybe the kitchen is okay, I don't know. But I actually have a separate room in my house where I do everything and I keep everything. As you can see, the closet is full of supplies. So first thing is wash your hands, and then you do need, I'm going to show you all of the items that you need. You also need a mask, so that when you open this up, you're wearing a mask. I don't want to be talking, and the nurse that's doing it, you don't want them to be talking and might, contaminate it. So you want to keep it as clean as possible. Now, so there's a few things that I'll show you as I go. I don't know how this is going to go. I haven't recorded myself changing my own dressing. It's hard as it is to do it with just my left hand. So I don't have two hands. Sometimes my husband will come in and help me. I've showed him how to put on sterile gloves and everything. So I even have his size. But he doesn't want to be on camera, so I'm going to try to do it on my own. So the things that you will need to change your dressing is a dressing kit tray, or dressing change tray, whatever. This is one that I have. I really like the dressing that it has in it. The inside of this is everything that I need: sterile gloves, a sterile mask that I can put on. There's the solution to clean my skin, which is chlorhexidine and alcohol swabs. Now, I don't use the chlorhexidine because it's really strong on my skin, so I ordered a separate swabs. These are Betadine swabs, or povidone iodine swab sticks. So I will use this on my skin so that it's not as harsh. And actually in the operating room for years, this is what we used to clean the skin right before an incision was made. The RN cleans the area that's going to be operated on. She cleans it with this, and then we would let it completely dry on its own. You don't want to rub it off. You don't even want to go like this to put air on it, because you're airing bacteria from the environment into your wound. So you just want to leave it alone and let it dry on its own, no matter how many minutes it takes. But I know that now in operating rooms, they're kind of moving away from betadine and they're using chlorhexidine. But anyways, I'm using betadine because it's less irritating on my skin. Once a week, if you have an extension tubing, this is the line and it's connected to this, which is the extension tubing. This way it makes it easy for me to reach and be able to use both my hands to give myself the antibiotic. If I didn't have this extension tubing, I'd have to do it from here, and I can't reach and I can't use both hands. So it is recommended that these extension tubes be changed every week. So I have another one here. And these are provided to me by my insurance. So I will open this up as well. I like to put in an extra pair of sterile gloves. Now these are not just exam gloves; they're sterile gloves. So just in case, since I'm only going to be using one hand, if I contaminate myself, I'll have another sterile ones there. I'll open up extra gauze. These are just like little 2x2 gauze. So if I need to use this, if for whatever reason I contaminate the one that's in the pack, I have another ones that I can have, because I don't have somebody else here that will help me and open up sterile items. So I'm gonna open these up ahead of time. And then I think that's it. You'll see once I open this, everything that's in it. So I'm gonna go ahead and start opening up. Let's see if I can change this or move it for you to see. Okay, so this is the way you open this package. You wanna try to touch as less as possible. It says peel here. So I have a little sterile tray that well, it's not sterile, it's just a tray that I always use, just an extra layer of protection from my table that I commonly use for other things. So I have my little sterile tray, my tray there. So I'm gonna open this. You wanna not touch the inside because the inside is sterile. So when you open, you peel. I'm not gonna touch in there. Peel it open. Not gonna, again, we are not going to touch in there because this is all sterile right now. So I'm only touching the edges. Okay, so that is good. That will be ready to go. There's a drape in there that's sterile for me to use. So the first thing I'm gonna do is I'm gonna grab that mask that is right on top. The way they package these items is specifically for this, so that the first thing you get is the mask. So I'm just gonna pinch. I'm not touching anything else. Now this that I touched now, the mask is contaminated. It is not sterile because I touched it with my contaminated hands. They're not clean. My hands are not sterile. So I'm putting on the mask so that as I'm talking, nothing will, no spit, no nothing will land on my sterile environment. Let's see if I can do that. Okay, so the next thing in there is this little square. It is the sterile gloves. But before I put on my sterile gloves, I'm gonna open up the other sterile items that I need. This is the extension. So as I open this, again, I'm only gonna touch the tips. I'm gonna peel away. And I'm gonna let the sterile item fall into my sterile pack. Now this is gonna be a little bit tricky because the outside is not sterile, only the inside is. So what I'm gonna do is I'm gonna open it and place it somewhere where it can stand, where I can just grab the swab sticks using aseptic technique. Okay, so, and I'm peeling it open. I have these little grooves to make it easier. And I'm not going to touch those swab sticks, the tips, because those are sterile. So maybe I can just, let's see how I can do this. I'm gonna lay it here so that, see how it's sticking out? Once I have my sterile gloves, I'll be able to just pull them out in a sterile way. Okay, like that. And I'm gonna get some extra sterile small gloves. And I should have opened the gauze first, but that's okay. I'm opening carefully so it can land in the sterile pack without touching any of that. I have seen a lot of nurses, RNs, coming in. Okay, this is not sterile because it landed on the tip that I had touched. So I throw that away and I'll get a new one. So I've seen a lot of nurses coming in and grabbing everything with with dirty gloves, no sterile technique, no aseptic technique. And I just don't understand why, if they don't know ask, be taught, learn. So I'm keeping this all nice and sterile. I'm going to grab an extra pair of, another set of 2x2 gauze. There we go. And sometimes things get contaminated. It happens. We're not perfect. There it is. It landed right there, nice and clean. Okay, so I will put on my sterile gloves now. Do this so you can see. Let's see how this is going to go. Once I have my sterile gloves, I'm not going to be able to move the, so I'm probably going to have to do this. Okay, I think you'll be able to see everything from there. I think I'll put a sterile gauze over the just in case I need to touch any items. What I'm going to do is I'm going to use this to put over my laptop so that I kind of will keep it sterile. And here's some larger gauze. This is 4x4 gauze. All right, now I'm going to get my gloves. I'm not sure how well you'll be able to see me putting on my gloves. Okay, so when I grab right now, I'm going to grab just the gloves. I'm going to try not to touch anything else or else that will be contaminated. So, nice and careful. There we go. The outside of this package that I'm touching right now is now contaminated, but the inside where the gloves are clean. And this is how you put sterile gloves. You open it carefully, only touching the edges of the package. First glove, just touch the bottom. Now the glove is sterile. I'm not going to touch the fingertips. There we go. Sterile hands. I'm not going to touch anything else. Sterile hands. Okay? All right. Now what I'm going to do, now these are sterile gloves, is grab. Now I can touch everything in here because my hands are sterile. This is the little drape. So let's see how I can move this. Like that. Grab the drape to create my sterile area. Here we go. This is all sterile now. I'm going to grab this offsite, nice and sterile. And I'm going to put this on my laptop so that it's nice and sterile. I hope that works. If not, I will use... Okay, and you know what I did? Before I got myself all sterile, I should have used just regular exam gloves to take the dirty dressing off. So it's okay, I'll show you right now. That's why I have my extra pair of sterile gloves. Now these are the gloves that come in the packet. I'll put them right here. So I've got some gauze, 4x4. I've got 2x2 gauze. The extension. Here are the ChloroPrep swab sticks that I don't like. So I'm not going to use that one because they're very irritating on my skin. It also has alcohol swab sticks, and these I will use before I use the Betadine. So these I will use. Now remember, this packet, this whole thing came in the sterile pack. So this one is sterile, the outside. It's okay for me to be touching it. This is gonna trip. There we go. They also have, the little pack also has gauze. Here's the little Telfa. I've noticed I really like using the Telfa, and I'll show you why later. But they have another 4x4, a 2x2, and this one with a little hole in it. It's much softer than this rough one. You see the difference? They also have sterile steri strips. I'll show you. You peel off only the edge so that it's easy to peel off and remove. So these you can use to stabilize the PICC line because you don't want to pull it out. You want to be very careful when you're cleaning this because you don't want to pull out the PICC line. And also, when I say pull it out, you know, this is long. It's going all the way into my superior vena cava. So you're not going to pull the whole thing out. But if you pull out a little bit and then you push it back in, that's contaminating into your body. So you want to keep the line the same. You don't want to be pulling out and pushing it in, because once it comes out, it touches your skin. Your skin harbors bacteria. So you want to push that back in. So if you use a steri strip to stabilize your line, then you will hopefully prevent that from happening. And then last in the pack is your dressing. These are very tricky. The way you peel these off is this is the backing. This is what you're gonna peel off. I've seen RNs come to my house and try to peel off in other ways. What you peel off is the back, okay? And then this part in here is the sticky part that will go on your skin and stabilize your line. So we will use that in the end. Okay, so now these gloves, I'm actually gonna contaminate them because I'm gonna start removing this dressing. Okay, but I do have my other sterile gloves right over here. So let's get these ready before I contaminate my gloves. These are the ones that came in the pack. They're all wrinkly, so sometimes they're harder to put on. I should probably open up another. Okay, so those will be ready to go. All right, so I'm going to contaminate my hands now. I'm not going to be able to touch this anymore. Okay, so we're going to start peeling off this dressing. This is going to be really hard to do with one hand. Now, before I started doing this, I actually wiped all around my skin and even over the edges of the dressing with alcohol wipes. Just, you know, another precaution to keep things clean as much as I can, as much as is in my power. So I'm peeling up slowly. You don't want to be rushed because you don't want to risk pulling out your line. So nice and slow. Haste makes waste. I'm still only touching the edges to try to keep the inside clean or sterile. So I'm only touching the edges. So, okay, so I have to make a call here. I think I'm going to use a Steri-Strip, or I can just use some tape to stabilize this so it doesn't move. Since I'm only using one hand, I'm going to use some tape. So I'm going to tape over here. Tape right there. That way I won't pull. Hopefully. I'm pulling away very carefully. There we go. Okay. So now you can see the line going in. I'm not going to touch that because my hands are now not sterile. They're dirty. So now I'm going to remove these gloves so that I can put on the clean ones, the sterile ones. Okay? Now, the way the nurse did my dressing yesterday, I was really uncomfortable because you see this purple? It's right on the fold of my elbow. So it was so uncomfortable sleeping at night. I couldn't fold this because then that little butterfly flap kept digging into my skin and itching me and just causing a ruckus. And so it was really uncomfortable. What we want to do is try to make this tube going up this way. Not to the side there. So I'm gonna try, ow, my hair comes off with that. Carefully move this up. Okay. All right. Stabilize that, just like that, because I'm gonna peel this off. All right, see, so now it's going up. It'll be much more comfortable. And the tape is holding that in place so that I don't accidentally pull that out. Now I'm gonna clean my hands with hand sanitizer before I put on the sterile gloves. You wanna rub. And you don't want to fan and you don't want to dry. You want to just keep rubbing and then the hand sanitizer will dry on its own. So this is the proper way to sanitize your hands using hand sanitizer. All right, so now it's completely dry. Now I can put on my sterile gloves. Oh, before I do that, let me get another pair of sterile gloves, just in case I contaminate myself. Small. Just open these up. Trash. Okay, let's put on sterile gloves. I'm only touching the tip, the part that's going to go inside my hand. I'm not touching the sterile fingers. Now you won't get them all, like my pinky right now, it's like, you're not going to get them on perfect, but once you get both hands in, then you can fix stuff. Okay, now I will grab the other, put 2 fingers in the cuff, and then start with 2 fingers. Good. Now I'm sterile. That's sterile. Okay, nice and clean. Now I'm going to clean this. You don't want to leave this open for too long. You want to be, in this part, you want to try to be as quick and as efficient as possible. So this is the alcohol. We're going to do 1 swab in circular motion. I hold it there at the exit site for a few seconds. And then clean the skin in a circular motion. I'm not gonna, now that I've gotten on the outer edge, I'm not gonna go back to the middle. Toss that. Get the next one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Nice round circular motion. Never going back. Trash. And the third one. This is trash now. Third one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Trash. So alcohol dries really pretty quick. So now I'm going to do the Betadine. Okay, I'm going to use this one to hold that. Pulling out my first Betadine. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Circular motion. Okay. Now I need to let that dry before. I've seen a lot of nurses take gauze and dab So to hurry up the drying stage, you don't want to do that. You want to just let it dry on its own. My right arm is getting tired. Let me see if I can use this to move the laptop. Okay, it's pretty dry. Now I will use the next one. Sorry, my phone is ringing. There we go. Nice and clean. I want to get the tube as well. Circular motion. Okay, nice big circle. Now this is trash. Now we will wait for that to dry. Just gonna rest my hand. So you don't want to make you want to make sure that you don't see any discharge coming out of your exit site, because that's a sign of infection. So far it's been good, and the exit site looks perfect. Oh, I am just seeing now that I do not have a BIOPATCH. Okay, so I'm gonna have to contaminate these hands. I'm glad I opened the other sterile gloves, because I need to open up myself a sterile BIOPATCH to use. I'm going to get this ready. While this dries, I'm going to go get a BIOPATCH. Here's the BIOPATCH. Again, my hands are not sterile anymore, so I'm going to open this using aseptic technique. I'm not going to touch the inside. I'm going to let it drop on my sterile. Well, before I throw that, let me see if I can show you. I know it's going to look backwards, but it's a BIOPATCH. Okay, so that's sterile there. I'm going to remove these gloves. Meanwhile, all this time, this is drying. Removing my gloves now. Okay, so I'm thinking I'm going to put another piece of tape a little further up before I put on my sterile gloves, so that this tape can stay outside of my dressing. Let's remove this one carefully. So that is still the same. It hasn't moved up and down too much, so that's good. It's still a little bit wet, so I don't want to put the dressing on yet. I want it to completely dry. You don't want moisture in your line. You want to try to avoid it as much as possible. So for me, even on hot days, I'll even avoid going out if I know it's going to be really hot outside, or if I'm going to be sweating or anything like that. I'll avoid it. I'll try to prevent myself from sweating, so that I keep this as dry as possible. Okay, I'm going to put my sterile gloves on now. I'm just holding the edge. Two fingers in the cuff, and then you open that little hole there. So sometimes you can't get all the fingers in, but that's okay. Now that I've got them both on, I can help myself. There we go. Okay. Sterile hands again. The nurse won't have to be changing gloves all the time, because when they do it, they should have everything ready. Again, this is how you do it. This is how you don't contaminate yourself. The items, everything, sterile aseptic technique. Please, RNs. I see so many of you contaminating yourselves all the time and then touching the sterile area, and then, oh, this is how you do it. Aseptic technique. Get trained. Okay, so this is pretty dry now. So now what I'm going to do, first thing, is apply the BIOPATCH. It has a little opening, and that is meant to make it easy when you take it off. So the opening is where the tube is. And that's it. It should stay there. This way, when you peel off the dressing, the BIOPATCH goes with the dressing and it doesn't pull on your line. I see so many nurses putting the BIOPATCH the opposite way, and then when we want to go ahead and change the dressing, you're pulling everything out. Alright, and now I'm going to use my nice little Telfa. The Telfa is looks a little shinier than regular gauze. This is more like fabric. And the Telfa is shiny and more like a plastic. So it's easier to remove when you're changing the dressing a week later. So what I do is I fold it in half. And then I just place it right underneath the little butterfly. Just like that. So then the line is never really in contact with my skin. This helps me out so much. All right, now I'm going to stabilize the line with a sterile steri strip. That's how you peel the sterile steri strip. Okay. There it is. Since we don't use stabilizers anymore and they don't suture the line into your skin anymore, the steri strip will help keep it in place. See how nice that is? Okay, now we will put on our dressing. Peel nice and carefully. These grooves are meant to be where the line is going to pop out. That's what those grooves are for. So I will There we go. Oh my gosh, that's it. See how easy that was? That is it. Now you will peel off the edges. Nice and easy. This will probably get it on my nerves over the week because it's right on my fold. But oh well. Peel off. Nice and easy. These have extra strips on them. This one with like numbers, like shelf life for the packaging. That's where the nurse is supposed to date it and initial it. I see a lot of nurses not doing any of this. So what they do is, now that this is covered, they can grab a pen and they can write the date on it and initial it, and then they'll stick that somewhere, anywhere. Okay. This other one is supposed to go underneath here, just as an extra barrier. I see a lot of nurses not using them. Now, now that my exit site where this is covered, it's okay. My hands, it's okay if I touch something that's not clean or not sterile because we're out of the woods. So I'm going to remove this tape that I had previously put to stabilize my line. Take that out. And I'm going to put this one underneath. Okay, let's see. This is so tricky to do with just one hand. Can you see? Okay, this is so hard to do with just one hand. There. Now it's underneath. So you just create a little hole for your line to pop out from. There we go. Nice and sterile. Now I need to change this tube. So what we will do is get some alcohol wipes ready and flush. Here's the flush. This syringe is not sterile. This packaging is not sterile. It says it on here. Do not place syringe on a sterile field. I see. Okay, so here is my clean tube. I'm not going to touch any of the tips because I want to keep it as clean as possible. I'm going to pull out a little bit and we're going to get all this air out. There's bubbles. Get the bubbles to the top. There we go. And I want to make sure that this is flushed. So now I'm going to push until I see, there it is. It's full of normal saline. The inside is sterile. Okay. Now we will get some alcohol pads, and I'm gonna wipe. You want to wipe it really good because this is like, you know, out, exposed, and it's hard to do again with one hand. Well, I'm not going to be able to do it with one hand. All right, I'm not going to be able to do it. I'm going to have to ask my husband to get some gloves on and take this tube out because it's really stuck in there into that red tip. And then what I'm going to do is connect this in here. Before I connect in there, you always want to wipe with alcohol. So I'm not going to be able to show you that, but just wanted to let you know after I take this tube out, then we will wipe with the alcohol, and then I will connect this one in there, and then I will push the saline in. All right, so that's it. I hope that this is helpful to you, and even though you are not the one that's expected to be doing your dressing changes, it's not recommended. Your nurse is supposed to do it, and RN is supposed to do it. The reason I'm doing it is because I've seen many RNs doing it wrong. So that's the reason I made this video, just so that you know how it's supposed to be done using aseptic technique. So when you see your nurse contaminating herself, himself, using dirty gloves to touch the sterile area, things like that, or opening the packaging in a wrong way, in a wrong manner, you can speak up and you can be your own advocate and you can say, hey, you're supposed to use sterile technique. Would you mind removing those gloves and putting on some sterile gloves? And if you don't feel comfortable with them doing it, then call somebody, tell them to stop and tell them, no, you're not doing it right. I want an RN that's going to do it right. Because this is your lifeline. I've gone through 4 infections because it's been done wrong, and I don't want that to happen to anybody else. I've had to be hospitalized for a week, for days, going through antibiotics, going through the side effects of antibiotics, going through sepsis, taking time off from work. I mean, it's a huge burden on my family, on my kids. I don't want to go through that again. I don't want to go through infections. And even though I have to say, no matter how much you do clean and sterile, there's still big possibilities you will get a line infection. Why? Because it's out. It's something that's coming out from your body. No matter what, bacteria gets in there. So we want to try to do the most that we can to keep it clean. And so I hope this brings awareness to aseptic technique, to the way that a dressing is supposed to be changed. And I hope it's helpful for you. And God bless you. I pray that there will be a cure for pulmonary hypertension soon. Thanks again for watching.